The fuck you lying? Why you always lying? Oh my god. Stop fucking lying. Always lying to me.
Okay, so there are a few pretty fundamental things you need from the state when dealing with a pandemic. A well-resourced healthcare system, mass testing, and a flow of information that the public can trust. Unfortunately, our government has flopped it on all three. Doctors, nurses, cleaners, carers and other key workers in the public sector are still having to go without adequate personal protective equipment. And despite being promised thousands, we only have a third of the ventilators that we actually need, with only 30 new ones being able to be used last weekend. And at our current woeful testing capacity, an already short-staffed NHS has struggled with getting enough clinical workers on the wards. The Royal College of Physicians has suggested that up to a quarter of all doctors are either off sick or self-isolating in a bid to prevent infection spreading to their vulnerable patients. And in addition to all this, the government's communications are all over the shop.
I mean, what sort of percentage of people need to have contracted the virus?
60% is the sort of figure you need to get herd immunity.
Is allowing this to spread to achieve herd immunity in any way government policy?
Herd immunity is not our policy, it's not our goal. Our goal is to protect life.
And I'm shaking hands continuously. I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody, you'll be pleased to know. And I've developed mild symptoms of the coronavirus, that's to say a temperature and a persistent cough.
But it's a different matter altogether when signals from the top are meant to shape the behaviour of the public, which in turn is what determines both the speed and the spreads of COVID-19. I get it, some of you might think that I'm being a bit harsh. After all, it's hardly been a month since Boris Johnson first convened a COBRA meeting to determine the government's response in the event of widespread infection of COVID-19 in the UK. Everyone's doing the best they can in the face of what's essentially a black swan calamity. Nobody could have seen this coming.
If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus.
And I suppose how you feel about the government's performance hinges on whether or not you think it's unreasonable that the National Health Service should be equipped to deal with national public health emergencies. Wild stuff, I know, but that's what those mavericks in Theresa May's administration were thinking back in 2016 when the NHS participated in exercise sickness.
That's Latin for swan.
Led by researchers at Imperial College London, exercise sickness wargamed over 3 days a national outbreak of pandemic flu originating in Asia. No, not ringing any bells. As well as forecasting such sunny scenarios as mortuaries overflowing and reaching dangerous capacity on critical care beds, exercise sickness found that the NHS were particularly challenged when it came to the availability of, you guessed it, personal protective equipment and ventilators. Instead of acting on the findings of exercise sickness, Theresa May's Tory government opted for ignore the report and inshallah. One can only speculate on why they didn't take the decision to invest in the UK's pandemic readiness. Maybe it was one of those things, like when mum asks you to get the chicken out the freezer, you end up in a SpongeBob vortex and then suddenly you hear the car pull up and that bird is still at the bottom of the deep chest. Or maybe for the austerity-obsessed political establishment, the certainty of cutting spending now was seen as more important as the possibility of saving lives later. I'll let you make up your own mind on that one.
Budget deficit. The deficit. Enormous deficit.
All the debt and the deficit.
So, if the government's own reports have said that we're fundamentally unprepared and ill-equipped for a pandemic in this country, why are Boris Johnson, his cabinet and everyone's favourite lectern-based scientific advisors insisting that everything is actually going according to plan? They can't even get the basics right. Poor old Robert Jenrick had 4,000 ventilators nicked off him in the hour it took to go from Kay Burley on Sky to an interview with the BBC. And he didn't even leave his house.
Let's talk about ventilators. How many do we have today?
Well, we have over, I think, 12,000. The number of ventilators which is 8,000 in the NHS today.
After boasting that they delivered
170 million masks.
the government had to row back on that last week and admit that the numbers were wrong. 170 million was the total personal protective equipment pieces delivered, which included 43 million gloves. In fact, there were only 23 million masks delivered and 1 million FFP3 respirators, far short of the numbers needed across the health and social care sectors. Nurses are still being told to just close their eyes if a patient coughs near them, and doctors are still being advised to only wear respirators when actually intubating coronavirus patients, so that there's enough to go around. Meanwhile, care homes in the UK don't even have enough of the basics like hand sanitizer, as both staff and care home residents mix with patients who are confirmed to have COVID-19. As for the antigen tests, which tell you whether or not someone currently has the virus, Deputy Chief Medical Officer Dr. Jenny Harries said a couple of weeks ago that the UK had moved away from testing and contact tracing coronavirus cases because there comes a point in a pandemic where that is not an appropriate intervention. And she seemed to suggest that because Britain isn't a low or middle income country, mass testing wouldn't be a high priority.
WHO comment. So I think the comment you were picking up was Dr. Tedros saying test, test, test. But in fact, we need to realise that the clue for WHO is in its title. It's a World Health Organisation, and it is addressing all countries across the world with entirely different health infrastructures, and particularly public health infrastructures. We have an extremely well developed public health system.
This was soon contradicted by none other than Deputy Chief Medical Officer Dr. Jenny Harries.
Definitely want to be doing more testing.
Who said that of course the government was ramping up testing capacity and that mass testing was a core component of its pandemic management strategy.
Well, I think that the one thing I'd add to that is we all know that Germany got ahead in terms of its ability to do testing for the virus, and there's a lot to learn from that, and we've been trying to learn the lessons from that.
Now, I'm not actually blaming Dr. Jenny Harries, Professor Chris Whitty or Sir Patrick Vallance for this dog's dinner of a public communication strategy. What's happened is that the government has chosen to use apolitical figures like doctors and scientific advisors as a form of PR Kevlar. If bad political decision making comes in the guise of scientific advice, there's enough diffusion of responsibility that no one's going to have to really be held accountable for it. And of course, when there's a big old screeching government U-turn, you can always hope that the charitable souls of the British press pack will claim that it's the science that's changed.
But there's no question that as the science has changed, that plan has massively accelerated.
It's not much to ask that our government be honest with us when we're facing the biggest national crisis since World War II. The Tories have a disease. It's called lie-abetes, and they don't look like they'll be making recovery anytime soon.